Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in the last video session, we have discussed the lots of the important questions, concept on the labor process. So now I am continuing the labor process here. Again, we will do the golden point chanting and the very important points revision for our upcoming Norcet exam. So whatever the thing we are studying the perfectly, we are studying with the updated guidelines, we are studying with the new concept that is necessary for our upcoming Norcet exam and any other state and central government exams. So once again, I am welcoming you all to the Master Nursing classes. If any one of you are new to our MNC family, so please do subscribe to the channel. And before entering to the live chat, so please hit the like button if you found the content is helpful and the previous classes are helpful. So don't hesitate to hit the like button if it is helpful for you. So please do share the video with your friends also, right? So very good evening, beta. Very good evening to one and all. A very good evening to one and all. Very good evening. Yes. Welcome you all once again to the Master Nursing classes. Good evening, beta. Good evening. Welcome. So some of you are very consistently attending the class. So this will make me very happy to give the deliver the content regularly, at least for you people who are attending the class regularly. Okay. So in this particular session also similar from my side, I will give my best content and I will give my best explanation. And you have to say that in this particular class, you people have to say that I will listen this one very carefully, very perfectly, and I will practice the important thing what the sir is giving. You have to say that one and you have to do that one. Okay. So that is the very important thing here. Okay. So without wasting a single minute, we will start the today's session. Very good evening, beta. Good evening. Okay. So in this particular session, we are going to discuss again the very important concept and the very important questions for our upcoming exam. If the questions directly not striking, means definitely the concept will strike in the exam. So believe in the concept, and that is the reason in the every session I will focus on the concept rather than the questions, because the concept is, means if examiner is asking question in any direction, you can answer the question very easily. Okay. So with this powerful motivational line, we will start the today's session. So the motivational line for you all is the never give up without a fight. At least you people can initiate, learn, understand, okay, improve your knowledge and give the best shot. So before doing the hard work, before doing the consistent preparation, if you are taking a back step, means that is gives the definitely bad result. Students, if you are working without thinking about the result, if the result is not coming our side also, yes, at the end of the day, we will not be get regretted that I have not studied, I have not prepared, okay, so I have not maintained the consistency. This kind of the things will not come in our mind, right? Yes, if you are working hard without having the attitude of the never give up, definitely the result will be yours. Okay, so believe me. Okay, so believe in yourself first and push yourself very hard. How much possible, that much you have to keep on revising the very important concept, okay, the questions that will be helpful for your exam, right? So without wasting the time, with this powerful motivational quote of the never give up without fighting, okay, so we will start the today's session. A good evening, beta. Very good evening. So here is the first question coming here in front of you all. So please do read the question carefully, completely, and try to give the best answer in the comment box. The question is very simple and very important. Yes, the question is, which of the following is the key clinical sign that indicates that I end of the first stage labor? So the question is regarding the first stage labor, okay, and its key clinical sign, okay. Which of the following is the key clinical sign, okay, so that indicating that which ends the first stage labor, okay. So option A, onset of the regular uterine contraction, beta. Regular uterine contraction onset means started, means which will start the first stage of the labor. But in the question what they have asked, so they have asked which particular clinical sign which indicates the first stage labor is end. But the option is telling here the first stage of the labor have been started. So it is not our question. Means it is not our answer here. Option A. So then comes to the option B. So full dilation of the cervix is 10 centimeter. Better. So cervix will be dilated in the latent phase and in the active phase. Okay. So according to the new guidelines, new proforma of the labor care guide. Okay. So now don't follow the modified WHO photogram. After updated version of the modified WHO photogram, we have the labor care guide. Okay. So in this one, there will be a cervical dilation which happens in the latent phase of the labor. So that is up to 0 to 5 centimeter. Okay. So the cervical dilation will happens in the latent phase of the labor according to the labor care guide. So 0 to 5 centimeter of the dilation will happens in the latent phase, and in the active phase of the first stage of the labor, so that is the 6 to 10 centimeter dilation will happens in the active stage of the first stage of the labor. Okay, so do remember the very important point. According to the labor care guide, new guidelines, in the latent phase, the cervical dilation will happen 0 to 5 centimeter, and in the active phase, that cervical dilation will happen from the 6 to 10 centimeter. This is the according to the new guidelines. Okay, so when the cervix is 10 centimeter dilated, we call that one as the full dilation of the cervix. Okay, so full dilation of the cervix. Here our first stage of the labor will end. Okay, so first stage of the labor will onset happens when the true labor pain begins. That time the first stage of the labor will start, and when the cervix will dilate completely full 10 centimeter, that time the first stage of the labor will end. Okay, so very important, remember, right? So the next golden point revision on the first stage of the labor. Remember that the first stage of the labor will begins with the onset of the regular painful uterine contractions and ends with cervix fully dilated for the 10 centimeter. Remember the first stage of the labor, right? So then what are the events which will happens in the first stage of the labor? Remember, a very important event which happens in the first stage of the labor is the dilation of the cervix. Okay, so cervix will get dilate here. So this is the very important event which happens in the first stage of the labor. How it will get dilate? I told according to the new labor care guide. Okay, so according to the new labor care guide guidelines, in the latent phase 0 to 5 centimeter will be dilation will happens. In the active phase 6 to 10 centimeter dilation will happens. Okay, so this is how the cervical dilation will happens according to the phase of the labor. Okay, if someone is asking the question, so what is the rate of the cervical dilation, means per 1 hour how much cervical dilation is happening. Okay, so the rate of the cervical dilation, do remember please, this is important. In the latent phase, in the primary gravida, means she is first time pregnant woman, in that first time pregnant woman in the latent phase 0.5 centimeter per 1 hour the cervical dilation will happens. Okay, so in the multigravida, means she is more than one time she is get pregnant. Okay, so in this particular woman in the latent phase 1 centimeter cervical dilation will happens per 1 hour. Okay, 1 centimeter dilation for 1 hour in the multigravida, and a 0.5 centimeter dilation in 1 hour in the primary gravida in the latent phase. Do remember the very important thing. Okay, so in the active phase of the labor, okay, so according to the old guidance, it is in the primary gravida, that is 1.2 centimeter per 1 hour. Okay, in the multigravida it is 1.5 centimeter per 1 hour. But now WHO says the standard, okay, so standard and the best criteria in the active phase, that is the 1 centimeter per 1 hour according to the WHO. Okay, so if you are remembering only one thing, that is more than enough. Okay, so but if the examiner specifically asking that in the primary gravida in the active phase, that is the 1.2 centimeter per 1 hour, and the multigravida in the active phase, that is the 1.5 centimeter per 1 hour. Okay, so this is the cervical dilation rate and the cervical dilation. Okay, so very important, like in the primary gravida and multigravida, how we have to divide that one. Okay, in the both active phase and in the latent phase, both we have discussed here. Okay, so hope it is clear to every one of you, right? So the next is the second event which happens here in the a very important first stage of the labor is the cervix becomes short here. Okay, so beta cervix becomes short here, and the cervix become a part of the our like upper uterine segment, and in the lower uterine segment it will makes the which is completely made up of the isthmus. Okay, so the lower uterine segment which is completely made up of the isthmus, and now the cervix will be starting upgoing, and the cervix will get short due to the whenever the cervix will dilate, the length of the cervix will get short. Okay, so the shortening of the cervix, we call that one as in the effacement of the cervix. Okay, so effacement of the cervix happens in the first stage of the labor. Dilation of the cervix will happens in the first stage of the labor. Beta, one more word it will comes, remember, that is the ripening of the cervix. Ripening of the cervix. This ripening of the cervix will happens in the pre-pregnantic, like in the pre-labor condition, means before the process of the labor onset, means before the first stage of the labor. So the cervix become short, cervix becomes soft, cervix is very rich in watery content. Okay, so that is what we call as the ripening of the cervix. Okay, it will happens in the pre-labor condition. Okay, it will happens in the pre-labor condition. Remember, the ripening of the cervix will not happens in the first stage. The ripening of the cervix happens before the first stage. Okay, so very important golden point what we have discussed here. Okay, so very important, try to keep in your mind, right? So these are the normal duration of the first stage of the labor. Okay, so the normal duration of the first stage of the labor. Okay, so usually the first stage of the labor, normal duration in the primigravida, the labor of the first stage should complete in the 12 hours. Means first stage of the labor complete means full dilation of the cervix should happens within the 12 hours. Okay, so in the multigravida, full dilation of the cervix should happen within 8 hours. Okay, full dilation of the cervix will happen within 8 hours. So this is the normal duration of the first stage of the labor. Okay, first stage of the labor normal duration is the in primigravida 12 hours, multigravida 8 hours. Okay, so in prolonged labor, if in a primigravida it should complete within 12 hours, I told this is the normal. But in the primigravida it is taking more than 28, it is taking more than 20 hours. So this is what I call as the prolonged labor. Okay, so what I call this one as in the prolonged labor, right? So in the multigravida, if it is taking more than 14 hours, means that is what I call as the prolonged labor. In the multigravida, normally it should complete within the 8 hours. If it is taking more than 48 hours, it is taking more than 14 hours. So that is what I call as the prolonged labor. Okay, so both these important criteria, hope it is clear to every one of you, right? Sir, as you told, sir, according to the WHO guidelines, okay, so in the active phase of the labor, okay, 1 centimeter dilation for 1 hour is, this is the standard cervical dilation which happens in the active phase of the labor according to the World Health Organization. Okay, according to the WHO, the cervical dilation rate at the active phase of the labor is the 1 centimeter per 1 hour. Then what is the protracted active phase, sir? What is the meaning of the protracted active phase? Yes, what is the meaning of the protracted active phase? Fatafat. Anyone want to answer what is the meaning of the protracted active phase? Beta, I told according to WHO 1 centimeter per 1 hour should happen as a cervical dilation. If cervical dilation is less than 1 centimeter per 1 hour, okay, means there is in the slow dilation of the cervix. Okay, so there is in the slow dilation of the cervix, I call this one as in the protracted labor. Sir, how I have to manage this one, sir? Sir, you have to increase the speed of the labor, sir. Here, what you have to do, sir? Here, increase the speed of the labor. So how we have to treat this one? We have to treat this one by increasing the speed of the labor, sir. Sir, how I have to increase the speed of the labor, sir? Sir, you please augment the labor, sir. Okay, this is what you call is in the augmentation of labor. Okay, so what is the augmentation of the labor? Augmentation of the labor means labor is progressing very slowly, so we are increasing the speed of the labor. Okay, that is what we call the augmentation of the labor. Okay, so total there are the two situations and the two terminologies you have to understand here. The first situation and terminology is the, that is, remember, one is like, I will explain with concept so it will be very easy for you all. Okay, so one is already labor started, but it's slow. Okay, but it is slow progressing, right? So here I am increasing speed of labor process. So I call this one as in the augmentation of the labor. What I call this one? I will call this one as in the augmentation of labor. Okay, so this is what we call as the augmentation of the labor. So one more situation you have to understand here. Uterus is silent here. Okay, so still labor not started. Okay, so uterus is silent, or we can say labor not started, labor process not started. So here I am starting the process of the labor. Okay, so what I am doing here, I am starting the labor process in a silent uterus or in the quiescent uterus. I am starting the labor process. So this particular concept, what I call as in the induction of the labor. Okay, so this one I call this one as in the induction of labor. Hope the concept is clear. What is the augmentation of the labor? Augmentation of the labor means already labor process have been started. Now it is, but it is slow, so I am increasing the speed. So that is the augmentation of the labor. Okay, so here the uterus is silent or the quiescent and the labor have been not started. So just I am started the labor here. So that is what we call as the induction of the labor. Hope the concept are clear here. Yes. So here in the protracted active phase, I am increasing the process or the speed of the labor. So that is what we call the management of the protracted active phase. Sir, what is the protracted active phase? According to WHO, at least 1 centimeter should dilate for 1 hour. If the cervical dilation is less than 1 centimeter for 1 hour, and the which is slow dilating cervix. Okay, so that is what we call as in the protracted active phase. So here I have to manage this one by augmenting the labor. Okay, sir, how I have to augment this one? So we have to do the artificial rupture of the membrane. Okay, so or we have to start the oxytocin drip slowly here. Okay, so that is the very important. That is after the complete dilation of the cervix. So we have to start the oxytocin infusion. Okay, so that's the very important. Keep in our mind, right? So next comes to the active phase arrest. What do you mean by the active phase arrest, sir? Beta, here according to WHO, I told at least 1 centimeter should dilate for 1 hour. Okay, but here in this active phase arrest, what happened? There is 4 hours passed. Okay, 4 hours time have been already passed, but no cervical dilation. Okay, but there is no cervical dilatation. So this is what we call as the active phase arrest. So how we have to manage the active phase arrest? Only one management, that is the lower segment cesarean section should we have to do in the active phase arrest. Okay, so this is the very important thing. Just try to keep in your mind. Yes, what is the protracted active phase? That is the less than 1 centimeter dilation for 1 hour, and the what is the active phase arrest? That is the 4 hours have been passed, but there is no any cervical dilation. So that is what we call as the active phase arrest. Okay, so hope it is clear to every one of you. And here's the next question. So please do mention the correct answer in the comment box regarding this particular question. It is important for every one of you. Just we have finished with the first stage of the labor, and all the golden points on the first stage of the labor. Now I am discussing with a best question on the second stage of the labor. Okay, so the question is very clear. So please do read the question carefully, completely. Yes, I'm waiting for your answer in the comment box. So please do all the options, read all the options and give the best answer. Yes, which of the following best describes the second stage of the labor? Okay, so which of the following statement which best describes the second stage of the labor? Option A. So the second stage of the labor begins with the onset of the true contraction. But a true labor contraction means true labor pain is beginning, means the first stage of the labor have been begun, not the second stage of the labor. Okay, so then the very important, that is the option B, begins with the full cervical dilation and ends with the delivery of the placenta. But the delivery of the placenta will happens in the third stage of the labor, not in the second stage. Okay, so it will happens in the third stage of the labor. I am eliminating the option B also, and option A, which is talking about the first stage of the labor. Okay, so this is the first stage of the labor, but the question have been asked related to the second stage of the labor. Then comes to the option C. Okay, so that is the begins with the full cervical dilation and ends with the delivery of the baby. Yes, almost all you people have given the correct answer. That is the option C. Okay, it actually begins with the full dilation of the cervix, means full dilation means 10 centimeter dilation of the cervix, and it will ends with the delivery of the baby. So that is the very important second stage of the labor. Okay, so this is the pure criteria of the meeting the second stage of the labor. Okay, so in order to rapidly revise, I will do the golden point here chanting for you all on all the stages of the labor. Total how many stages we have? We have the 4 stages. Okay, we have the 4 stages. Okay, so in this 4 stages, the first stage, second stage, third stage and the fourth stage. Okay, so in the first stage it will start with uterine contraction. Okay, so that is the true uterine contraction. Okay, it will start with the uterine contraction and it will ends with 10 centimeter dilatation of cervix. So this is what we call this one as in the first stage of the labor. Okay, so in the second stage of the labor, what happens in the second stage of the labor? Okay, so here it will starts with full dilation of the cervix. Okay, it will start with the full dilatation of cervix and it will ends with expulsion of fetus. Okay, so that is the fetus expulsion, or the we can say the delivery of the fetus. Okay, it will ends with the fetus expulsion. The question will come, in which stage of the labor the fetus will comes out of the uterine cavity? Yes, in which stage of the labor the fetus expulsion will happens? In the second stage of the labor the fetus expulsion will happens. Okay, so very important. Comes to the third stage of the labor. Okay, so next one is the third stage of the labor. This one, it will get starts with a very important, that is from the fetus expulsion. It will start with the fetus expulsion or the fetus delivery to it will ends with delivery of the placenta. It will ends with the delivery of the placenta. The question will come in your exam, in which stage of the labor, the placenta will get delivered? So in the third stage of the labor, the placenta will get delivered. Okay, so the last one is the fourth stage of the labor. So this is the monitoring phase. Okay, this one is the monitoring phase. Okay, here we have to monitor for the physiological change in the mother, and we have to monitor for the very important, we have to monitor for the risk of the postpartum hemorrhage. Okay, so very importantly, try to understand all the 4 stages of the labor. Okay, so in the first stage the full cervical dilation will happens. In the second stage fetal will get expulsed. In the third stage placenta will get delivery, and in the fourth stage we have to monitor for the PPH. Okay, so very important, keep in your mind all the 4 stages and its golden points, right? So the question was here. Okay, so the correct answer for this particular question is very much clear here. Okay, so now I will discuss the golden point chanting on the second stage of the labor, because it is very, very important. So let me comes to the second stage of the labor. Okay, so I taught already. So the period from the full cervical dilation till the expulsion of the fetus, or till the birth of the particular baby, we call this one as in the second stage of the labor. Okay, so here, so in the second stage of the labor, so what was the duration of the second stage of the labor? In the primigravida, okay, so for the expulsion of the fetus, she will takes the 1 hour, means the duration in the primigravida is 1 hour, and in the multigravida, in a 30 minutes, the baby will comes out of the particular vagina. Okay, so that is the duration of the second stage of the labor. In the prime is 1 hour, in the multigravida is the 30 minutes. If in the primigravida she is taking more than 2 hours, so that is what you call the prolonged labor, or the prolonged second stage of the labor. And multigravida, if she is taking more than 1 hour, actually multigravida should complete within 30 minutes, but she is taking more than 1 hour, so that is what you call as the prolonged second stage of the labor. And in the primigravida, actually she should complete within 1 hour. If she is taking more than 2 hours, so we call that one as the prolonged labor, or the prolonged second stage of the labor. Okay, hope it is clear to every one of you, right? Consider, if in the primigravida it is going more than 2 hours, and in the multigravida it is going more than 1 hour, means the mother is in the second stage labor, she is in the prolonged second stage labor condition. So how we have to manage that one, how we have to treat that one? Okay, so before starting the any intervention, first we will check the station of the fetal head. Okay, so where the fetal head is located. Okay, so how much the fetal came down, because in the second stage of the labor, the first priority goes to the early delivery of the fetus out of the maternal canal. Okay, so we want to remove the fetus out of the maternal canal as soon as possible. Okay, so here, if the prolonged second stage is going on, means just I will use a simple important techniques. Okay, so that is the I will check the station. If the station of the fetal head is +2 or below, if the station of the fetal head is +2 or below, means this is 2 centimeter below the ischial spine. So now I will go for the instrument delivery. I will go for the instrument delivery. Okay, so where I will use the vacuum delivery, or I can use the forceps. Okay, anyone I can use. Okay, vacuum delivery or the forceps delivery, anyone I can use here. Okay, so if the fetal head have not crossed the ischial spine, or it is above the +2 station, means it is above the +2 station, which is not at the level of the +2 station, means I will go here for the LSCS. Okay, so that is the lower segment cesarean section. Okay, so this is the how we have to manage the second stage of the labor if it is going the prolonged second stage of the labor. Okay, if in case during the second stage of the labor, while delivering the fetus is get distressed. Okay, so how we have to manage? Okay, fetal distress in the labor. Okay, so how we have to manage in the first stage? Better, in the first stage, cervix is still not completely dilated. Okay, cervix not completely dilated. So we don't have any option to do the instrumental delivery or to do the like forceps or vacuum delivery. Just only one option we have here in the, if the fetal distress happens in the first stage of the labor, directly go for the directly go for the lower segment cesarean section. Okay, in the second stage of the labor, the cervix is fully dilated. Again, if the fetal distress have been happened, means again I will check the station of the fetus here. Okay, so again I will check the station of the fetus. If the station of the fetus is the +2 or below the +2, means I will go for the forceps delivery. If it is +2, okay, or it is above the +2, which is not +2, okay, it is above the +2. Okay, so again the option is the only one remaining, that is the lower segment cesarean section. Okay, students, Here I written instrumental delivery. Okay, so the vacuum also I can use, or I can use the forceps. But when the fetal distress is there, okay, when the fetus is in a situation of the distress, okay, so directly if it is below the +2 station, I written only forceps delivery. I have not written the vacuum delivery. Why? Because remember the golden point. If the fetal is in distress, okay, if the fetus distress is present, don't use vacuum delivery. Okay, so don't use vacuum. Why, sir? Why? Because if the fetus already in the situation of the distress, and whenever we are trying to deliver the fetus by using the vacuum machines, it will require some time to create the vacuum. Okay, so to create the vacuum, it requires some time. But the already fetus is in distress, we don't have time here, so I will not use the vacuum. Okay, so directly I will go for the forceps delivery in the fetal distress. Okay, if it is fetal head is +2 station or the below. Okay, so above the +2 station means we don't have any option, that is the LACS. Means for this from this particular thing we got to know about one very important thing. Okay, that if you want to do the instrumental delivery means fetal head must and should be below the +2 station. Okay, so this is the golden point you have to remember. Okay, here. Okay, so hope you have enjoyed the second stage of the labor and understand the second stage of the labor. Okay, so here is the next very important question. So, and very, very important concept for our upcoming exam, right? Which of the following sign of the placental separation during the third stage of the labor? Okay, very, very important again. A very, very important question. Which of the following is the a sign of the placental separation during the third stage of the labor? During the third stage of the labor, which of the following is the sign of the placenta separation? Option A, decrease in the uterine size. Option B, sudden cessation of the uterine contractions. Or option C, gush of the blood and lengthening of the umbilical cord. And option D, fetal head retraction into the birth canal. So which of the following is a sign of the placenta separation during the third stage of the labor? Yes, in the third stage of the labor, main event happening is the delivery of the placenta. Okay, so which of the following is the sign of the placenta separation? So I want everybody's answer in the comment box. So for to mention your answer in the comment box. So I'm waiting for your response. Yes, a very good, beta, very nice of you all. Okay, so that is the here. If the placenta is get separated, understand the concept. So this is the uterus, and here will be the placenta. Okay, so you know the weight of the placenta in the term is the 500 gram. Okay, so that is the half kg. When this placenta is separated means from here the 500 gram weight is reduced. Okay, so this particular placenta which is pulling the uterus like this down, whenever it will separates, so that time what happens, the weight will be reduced here and the height of the uterus slightly will increases. Okay, slightly height of the uterus will increases at the fundus. Okay, so slightly height of uterus increases at fundus. But in the option A, they are given decrease in the uterine size. So this is the wrong one. Okay, I'm eliminating this one, right? So then the option B, sudden cessation of the uterine contraction. No, uterine contraction will increases, not it will get stop. Okay, so this is also not a sign of the like placenta separation, right? Option C is the gush of the blood, okay, and lengthening of the umbilical cord. You know, here it is the placenta is attached to consider, and here will be the umbilical cord, right? When this placenta will get separate, so that time suddenly the huge amount of the blood will comes out of the vagina. Okay, consider now placenta came here, means the length of the umbilical cord looks more in the extra vaginal area. Okay, so that is the gush of the blood and the lengthening of the umbilical cord, so which indicates the very important sign of the our a very important sign of the placenta separation. Okay, so the correct answer goes to the option C, right? So option D, fetal head retraction in the birth canal. So this is not a correct answer. I'm eliminating the option D also. So what are the sign of the placenta separation? So understand the gush of the blood, okay, which comes out of the vagina, and the umbilical cord length will be increased or the longer here, and the uterus rises over the abdomen slightly, and the uterus become round in shape and the firm. Okay, round in shape and the firm, very importantly. So these are the very important sign of the placenta separation, right? right? Okay, so very importantly, please do remember these all things because it is the important for your exam, right? So next comes to the third stage of the labor and its golden points I am discussing now. Okay, so the third stage of the labor, okay, which begins with, already we have discussed, immediately after the birth. Okay, it will begins with immediately after the birth of the fetus. Okay, so then it will ends with the expulsion of the placenta. The main event in the third stage of the labor is the to deliver the placenta, right? So in the first stage, cervix is completely dilated. In the second stage, fetus came out, and in the third stage, the placenta will come out. Okay, so the duration of the third stage of the labor, that if you are managing actively means it will be 5 to 10 minutes, and if you are managing passively means it will be 15 to 25 minutes. Better, which one we will recommend here? So the best one is the active management. So what is the active management? What is the passive management, sir? So please explain the concept, sir. Yes, I'm here to explain the concept. Don't worry about that one. Okay, so in the placenta or in the third stage of the okay, in the third stage of labor, in the third stage of labor, the main event is the placenta delivery. Okay, main event is the placenta delivery. Okay, if the surgeon or the primary healthcare provider, what we can say, he is doing nothing, he is doing nothing. Okay, so placenta is separated itself, and due to the uterine contraction, placenta delivering without any intervention. Okay, so this is what we call as, we are not doing anything means we are not active here, so we are passive here, okay, so this is what we call as the passive management of the third stage of the labor. What we call this one? We call this one as the passive management of the third stage of the labor. Sir, here the primary healthcare provider or the surgeon is doing nothing, so the placenta is delivering itself. Okay, so uterus will contract and the placenta will deliver itself without any intervention, and this is what we call as the passive management of the labor, and which is taking the time duration of, okay, so which is taking the time duration of 15 to 20 minutes. Okay, so in the passive management of the third stage of the labor, so this one, it is taking the time duration of the 15 to 20 minutes. Okay, so in the 15 to 20 minutes means here the more bleeding will happens. Okay, so more bleeding will happens. Okay, so more bleeding is happening means, you know, the most common cause of the maternal death is the bleeding. Okay, so there is increased risk of the maternal mortality. Okay, increased risk of maternal mortality. So that is the reason the passive management of the third stage of the labor is not recommended. It is not recommended. Where in other hand, what happening here? So here the surgeon or the primary health care provider, he is doing some active interventions. Okay, he is doing some interventions. Okay, he is doing some interventions. Okay, from which he is delivering the placenta early. Okay, so placenta he is delivering early. Okay, so here he is doing something means he is completely active here. The obstetrician or the primary healthcare provider or the surgeon, he is doing some activity here means we call this one as the active management of the third stage of the labor. AMTSL is the very important one. So in the last 3 Norcet continuously question have been arised from this active management of the third stage of the labor. Okay, so if we are actively managing the case means it will hardly takes about the only 5 to 10 minutes. Okay, so it is completing Okay, so the active management of the third stage of the labor, which is completing within 5 to 10 minutes. Okay, it is completing within 5 to 10 minutes, means there is less bleeding. Okay, so there is less bleeding will be there. So less bleeding means, yes, obviously a low maternal mortality. Low maternal mortality. So that is the reason this one will be recommended. Okay, so the active management of the third stage of the labor is the recommended one. Okay, so very important concept for your understanding purpose and your basement purpose to create the and to teach the active management of the third stage of the labor. Now we will study the important thing about the active management of the third stage of the labor, and here we have the four important steps in the active management of the third stage of the labor. So what are the stages or the steps in the active management of the third stage of the labor? We will study in detail, because from there only question will arise in your competitive exam. Okay, sir, let me start the very important active management of the third stage of the labor here, right? Yes, the steps in the management of the third stage of the labor, there is the active management of the third stage of the labor. What we are doing means, here the obstetrician or the surgeon or the primary healthcare provider actively doing some interventions, means he is doing or he is like pulling some like umbilical cord to remove the placenta out, and he is administering some uterotonic medications like oxytocin, or he is doing some interventions to remove the placenta. Okay, he is actively involved there. So that is what we call the active management of the third stage of the labor. Okay, so in this particular situation, the first step. Okay, so first step, what we have in the active management of the first stage of the labor, the first step is the administration of the uterotonic drugs. What is the meaning of the uterotonic drugs? Where the utero means that is the uterus, tonic means, yes, the tone of the uterus. So the uterotonic drugs are the drugs which increases the tone. Okay, so which increases the contraction of the uterus. So that is what we call as the uterotonic drugs. Okay, so first line drug which one we have to use here is the, that is our very important oxytocin. The WHO recommends the best and first drug in the active management of the third stage of the labor, that is our oxytocin. Okay, so we have to give this oxytocin 10 international unit in the normal saline or in the ringer lactate. Okay, so we can use the NS or RL, but never use the dextrose. Okay, so never give the oxytocin in the dextrose, because this dextrose will increase the water intoxication. Okay, it will increase the water intoxication. Very important. Remember, if you want to give the oxytocin infusion, so give with the NS or give with the ringer lactate. Don't give with the dextrose, because the dextrose increases the water intoxication. And the route of administration is the IV and IM also we can give, but it will take the very important 30 minutes to get start of its action, and it will act for the 3 hours IM. Okay, so if you are giving the oxytocin IM, it will start acting after 30 minutes, and it will act for the duration of the 3 hours. But we don't want both. If we are giving IV, it will start act within 1 minute, and it will start the duration of the action of the oxytocin in the IV route is the 1 hour it will act. Okay, so that's the very important, right? The dose of the oxytocin is the 10 international unit in the 1 pint of the normal saline. Okay, so for the route is the IV infusion. Remember, never ever give the IV bolus. Okay, so never give IV bolus. Means just I have loaded the 10 international unit and I will push in the IV canal like this. Never ever give the IV bolus of the oxytocin, because it will cause the heart to get land into the failure. Okay, so that is the very important concept I am telling regarding the active management of the first stage of the labor. Here the uterotonic drugs. In the uterotonic drugs, the first line drug and the WHO recommended drug is the oxytocin. The dose is 10 international unit in the 1 pint of the NS. Route is IV infusion, means we will do the infusion. We will not push the IV directly. Okay, so then intramuscular also we can use, but it will start after the 30 minutes and it will act for the duration of the 3 hours. But we are giving the IV infusion, means within 1 minute it will start. It will work for the duration of the 1 hour. Okay, so recommended one is the IV infusion with the normal saline is the best one. Okay, so never give IV bolus and never give with the dextrose, right? So very important one. So the other alternative drugs we are having here is the, that is the methyl argometrin and the Synthometrin. Okay, so this methyl argometrin or the metharzine, we will give this one in the intramuscular route. Okay, so the dose is the 0.2 microgram is the dose where we will give the intramuscular metharzine or the methyl argometrin intramuscularly. Okay, so then the synthometrin, in the synthometrin, what we have here, the syntho means here is the oxytocin. Okay, synthometrin is the combination of the both oxytocin and the methyl argometrin. Okay, so this is the oxytocin, and it is having the standard dose. How much oxytocin we have here? So that is the 5 international unit of the oxytocin is here. Okay, so then the methyl argometrin, how much it is there? So that is the 0.2 microgram of the methyl argometrin will be there here. So both, which will make the a very important synthometrin. Okay, synthometrin is the combination of the oxytocin plus methyl argometrin. But the best drug which is recommended by the WHO is the our very important oxytocin. Okay, so that is the WHO recommended drug, right? So what are the other drugs we will use here? So we will use the prostaglandin also, that is the misoprost, that is the prostaglandin E1, and we will use the very important, that one is the carbic prost, that is the prostaglandin F2 alpha. But we will never ever use the prostaglandin E2. Why? Because prostaglandin E2, it will act on the cervix only, and it will make the like ripening of the cervix. It is not able to initiate the contraction of the uterus. So that is the reason the prostaglandin E2 or the carbaprost 1. Okay, so don't like confuse between the carbaprost and carbaprost 1. Okay, so carbaprost is the, that is our very important. Prostaglandin F2 alpha is the carbaprost, and the carbaprost 1 is the, that is the carbaproston. Carbaproston is the prostaglandin E2. Prostaglandin E2 is only responsible for the ripening of the cervix, and it is not having the ability to contract the uterus. So prostaglandin E2 we will never ever use in the case of the PPH control or in the active management of the third stage of the labor. Prostaglandin E2 or the carbaprost 1 is the not used. Okay, so remember. Okay, hope the concept is clear to every one of you, right? So this is the very important concept, right? I told here the one drug, that is the methyl argometrin. So this methyl argometrin, so which is very dangerous uterotonic. Okay, so whenever we will give the metharzine or the methyl argometrin, so this is the very dangerous uterotonic drug, and which is having, so please make a correction here. So it is not 2 microgram, 0.2 milligram. Okay, so that is the 0.2 milligram. Okay, so do correction that one, right? So whenever we will do the metharzine, that is the 0.2 milligram, that is by the intramuscular route. Okay, so in this particular situation, what happens? So it will causes the tetanic uterine contraction. Okay, so it will causes the tetanic uterine contraction. So this tetanic uterine contraction, what it will do? It will suddenly contract the mother uterus, and the whatever the blood which is there in the uterus, it will suddenly comes to the maternal circulation. So suddenly the cardiac load will be increased on the heart of the mother. So whenever the mother with heart disease is there, so metharzine is not recommended, because it will cause the tetanic uterine contraction and suddenly increases load on maternal circulation. Okay, so suddenly increases the load on the maternal circulation. So that is the reason, if any organic heart disease is there in the mother, okay, if any organic heart disease is there in mother, metharzine is contraindicated. Okay, metharzine is contraindicated. Very important. Do remember why metharzine is contraindicated, because the metharzine is the very dangerous uterotonic, and it will cause the tetanic uterine contraction, means sudden spasm of the uterus, which suddenly increases the blood to the maternal circulation, which increases the load on the maternal heart. Okay, so which will cause the heart to get land into the failure. Okay, so heart failure will happen. So that is the reason in the organic heart disease mother, the metharzine is contraindicated, and metharzine we will never ever give in the case of the organic heart disease mother. Okay, along with this, if the mother is having the hypertension, okay, so that is the pregnancy induced hypertension, and in the preeclampsia and in the eclampsia, okay, so we will never ever give the metharzine. Okay, so to remember the contraindication of the metharzine, from here the question will be struck in your exam, because it is important. Do remember this particular 5-star concept. Okay, so contraindications of the methergine. How we have to remember the contraindications of the methergine? So like this, by using the mnemonic called as the topper. Okay, so T stands here as the, yes, there are the twins is there. In the twins, one baby is delivered. Okay, another baby inside the uterus. So that time don't give the methergine. Okay, so contraindication of the methergine or the methyl argamentrin, after delivery of the first twins, still one twin is inside. So that time, so in the twins delivery, okay, after delivering the first twin, don't give the methergine. Methergine is contraindicated. Okay, if the mother is having any organic heart disease, I told just any organic heart disease, like there is in the cardiac overload already is there. If you are giving the methergine, suddenly it will contract, the maternal blood circulation will be overloaded by the blood and it will lands again into the heart failure. So if the mother is having the organic heart disease, don't give the methergine. Okay, so then comes to the third very important point, that is the pregnancy induced hypertension, preeclampsia, eclampsia. Okay, so in case of the increased bp, in mother, already bp is increased, so if you are giving the methergine, means suddenly it will contract, again the blood pressure will increases. So that is the reason in a case of the increased bp, so that is in case of the pregnancy induced hypertension, in case of the preeclampsia, in case of the eclampsia, so all increased bp cases the methergine is contraindicated. Okay, so very important, remember. Then the E stands eclampsia, P stands preeclampsia, and the again P stands here the pregnancy induced hypertension. Okay, so the last one is the, that is the RH incompatibility, or in the RH negative mother also we will not give the methergine. These are the very important contraindications of the methergine, so which will be striked in your exam directly. Okay, right, hope it is clear to every one of you. The next is a very important concept and question. So the first step of the active stage of the third stage of the labor we have done here. Okay, one second please. Right, so in the active management of the third stage of the labor, the first step is the administration of the uterotonic drugs we have completed. So WHO recommends to give the oxytocin and all other related questions and concept I have cleared to you all. Okay, so the second step here is the, that is the controlled cord traction. Okay, so second step is the controlled cord traction. What we will do here, so we will also call this one as in the MBAT. Okay, or we can say that is the M stands here as the modified Brand Andrews technique. Okay, so MBAT stands here as the, that is the modified Brand Andrews technique, is also another name of the controlled cord traction. So what we will do here, after separation of the placenta, okay, so usually initially this is the uterus and this is the placenta is attached to the uterus. Okay, so now after separation of the placenta, okay, so after the separation of the placenta, in order to remove the placenta out of the uterus, so we will slightly keep the one hand over the mother symphysis pubis. Okay, so the pubic pressure, and another hand, like we will slowly pull the placenta out. Okay, so this is what we call as the controlled mannerly we are tractioning the cord. Okay, so that is the controlled cord traction after giving the opposite slide pressure by the suprapubic pressure, and in one hand we will pull the slowly placenta. So that is the controlled cord traction or the modified Brand Andrews techniques. So this will be a second stage of the active management of the third stage of the labor. Okay, so again the fourth one is the delayed cord clamping. So why we have to do the delayed cord clamping in the active management of the third stage of the labor? Better, what do you mean by the delayed cord clamping? You just try to understand first. If the cord clamping which we are doing within 1 minute after birth, that is what we call as the early cord clamping. Okay, this early cord clamping, this is not a part of active management of the third stage of the labor. Okay, it's not a part of the active management of the third stage of the labor. Okay, so remember, so in the active management of the third stage of the labor, what we have the delayed cord clamping. We don't have the early cord clamping. Just I have mentioned here to like differentiate what is the delayed, what is the early cord clamping. Okay, so if the cord clamping you are doing within 1 minute after birth, so that is the early cord clamping, and the cord clamping you are doing 1 minute to 3 minutes after the birth. Okay, so you are waiting for the 1 to 3 minutes, and after the 3 minutes you are cutting the umbilical cord, means that is what we call as the delayed cord clamping. What is the purpose? What is the purpose of this one? Why? Because in the umbilical cord there will be 80 ml blood will be there. Okay, so if we are delaying for the 1 to 3 minutes, that 80 ml blood from the umbilical cord, it will comes to the fetus. Okay, so it will decreases the risk of anemia in fetus. Okay, it will decreases risk of anemia in the fetus. So that is the reason in the active management of the third stage of the labor, we will wait for the duration of the 1 to 3 minutes. Okay, then after that we will clamp the our umbilical cord. Okay, so remember, right? So this particular early cord clamping is not a part of the active management of the third stage of the labor. Hope it is clear to every one of you, right? So I told there are the 4 steps are there in the active management of the third stage of the labor. First one is the injection uterotonics, where the WHO recommends the oxytocin and other drugs also we have discussed, and the metharzine we have discussed, and the side effect of the metharzine we have discussed, and oxytocin should be given with the normal saline, don't give with the RL. Okay, sorry, oxytocin should be given with the normal saline and the RL, and don't give with the dextrose, because the dextrose increases the risk of the water intoxication, and oxytocin should be given by IM route or by the IV infusion, not by the IV bolus. So the very important thing we have discussed, right? So after that we have discussed the controlled cord traction. Okay, so that is the modified brand Andrews techniques with image based questions. Then after that we are discussing the delayed cord clamping. Okay, so that is the cord clamping after 1 to 3 minutes after the birth of the baby, that is the delayed cord clamping. So here, in order to provide the blood to the fetus, we are doing the delayed cord clamping. So that is the very important one. Okay, so then the last one is the intermittent assessment of the uterine tone. Okay, so after the placenta separated, we need to monitor for the postpartum hemorrhage. So that is the reason the most common cause of postpartum hemorrhage is atonic uterus. You know, atonic uterus means there is no any tone is there in the uterus, means the uterus is unable to contract, so that uterus bleeds more, so which will cause the postpartum hemorrhage. So that is the reason immediately after the delivery of the placenta we need to assess for the uterine tone. Okay, so here assess for the tone of the uterus and examine the birth canal. Okay, if there is any tearing is there, any bleeding is there from the birth canal, that one we need to examine, and continue to monitor the maternal vitals and the vaginal bleeding of the, we need to closely monitor here. Okay, so because there is in the vaginal bleeding which indicates the postpartum hemorrhage, and which happens due to the atonic uterus. And remember, the hemorrhage, the postpartum hemorrhage is the most common cause of maternal death. Okay, so this is the most common cause of the maternal death. So this is a very important point, just you have to try to remember here. Okay, so all the golden point chanting on the active management of the third stage of the labor we have completed here. Okay, so the next question is here in front of you, so please do read the question carefully, completely, then try to give the best answer. Yes, which of the following is the most common cause of the uterine inversion during the third stage of the labor? Beta, I told the modified band Andrews technique or the controlled cord traction should be done after the separation of the placenta. Okay, so here the placenta is separated, then after that we will slowly pull the particular placenta. If the placenta is not separated and you are pulling the particular what we can say like umbilical cord, so umbilical cord it will pulls the placenta, and the placenta it is not separated means it will pulls the uterus also, and it will pulls the uterus, so uterus becomes like this here. Okay, so uterus becomes like this, again you are pulling down here means like you are pulling down again. Okay, so the placenta it will comes here, the placenta it will comes here. Okay, with umbilical cord, and along with the placenta what happens here, along with the placenta our uterus also it will comes like this. Okay, so uterus, the outer portion is coming inside. Okay, so that is what we call the inversion of the uterus. Okay, so inversion of the uterus will happens if the placenta is not separated, you are pulling the placenta, that time the uterine inversion will happen. So during the third stage of the labor, be aware of this one. Okay, which of the following is the most common cause of the uterine inversion during the third stage of the labor? Yes, the duration, like Most common cause of the uterine inversion in the third stage of the labor is option A, prolonged labor, which is not related to the inversion of the labor, like placenta. Then the retained placenta. Then comes to the option C, excessive traction of the umbilical cord before placenta separation. Okay, so excessive traction of the umbilical cord, you are pulling the umbilical cord excessively before the placenta separation. So this is the most common cause of the our uterine inversion in the third stage of the labor, which is very very important. Just try to keep in your mind. Okay, so what is the uterine inversion? Uterine inversion is the outside uterus is coming in like this. So this is what you call as the uterine inversion due to the pulling of the placenta before separation of the placenta. Okay, so hope it is clear to every one of you, right? So this is the a very important concept you have to remember here. Okay, so here is the next question and the next concept. So what is the primary focus during the fourth stage of the labor? During the fourth stage of the labor, I told already. Okay, so in the rapid revision session. Okay, so here, right, in the fourth stage of the labor, I told, okay, so we have to monitor the, this is the monitoring phase. The mother will land into the maternal chills, and there is the highest chance of the postpartum hemorrhage will be there. So priority goes to the monitoring of the postpartum hemorrhage and the monitoring of the bleeding in the fourth stage of the labor. Okay, so very very important, try to keep in your mind. Okay, so the question is asking like this: which of the following is the primary focus? Which of the following is the primary focus during the fourth stage of the labor? So that is the monitoring the fetal descent. Better fetal descent we will monitor in the second stage of the labor. Okay, how the fetus is coming down in the cardinal movement of the fetus, we will monitor that one in the second stage of the labor. Okay, so the option B, monitoring the uterine involution. Monitoring of the uterine involution, we will monitor this one in the third stage of the labor, because while pulling the placenta, the uterus may come along with that one. So uterine inversion I will monitor in the third stage of the labor, not in the fourth stage of the labor. Okay, so then the option C, observing for the mother for the postpartum hemorrhage. Okay, so this is the a very very important answer for this one, and many of you have given the correct answer. So hope it is the clear to every one of you, right? So yes, observing for the mother for the postpartum hemorrhage is the a main focus in the fourth stage of the labor. Okay, so hope every one of you have enjoyed the session, and in the tomorrow session we will discuss a important questions and concept. Okay, so last two more class I will finish the OBG. Okay, so then after that we will go for the pharmacology, MSN and system wise sections. Okay, so hope it is clear to every one of you, right? So here is the assignment question. Here the assignment question, the question number 1. So that is most common cause of postpartum hemorrhage, which one? Okay, second one, most common cause of the maternal death. The question is, second question is most common cause of maternal death. Okay, so what is the correct answer? Then the question number 3, that is according to the new labor care guide. Okay, so according to the new labor care guide. Okay, so cervical dilation in active phase starts from, okay, cervical dilatation in active phase starts from dash. Okay, so from how much centimeter, whether it starts from the 0 to 5 centimeter or the 6 to 10 centimeter. So we have to mention in the comment box all these 3 questions and its answer. Okay, so hope today's session you people have been enjoyed, and in the tomorrow session I will again come with a very important question concept with the rapid revision session. Okay, so stay connected, stay motivated, keep preparing. If you are working hard and if you are working on the quality content, definitely result will be yours, and no one can stop you to get select in your exam. Okay, so I hope every one of you have enjoyed the session, and if any one of you are watching for the good test series practice for your upcoming Norcet exam, here we have the Super 60 test series, which is live from the morning 6 a.m. to 11 p.m. and at the 11:30 p.m. So the result will be yours. Okay, and it will be exactly on the basis of the new pattern of the Norcet exam, that is the question section, 5 sections, which every section contains the 20 multiple choice questions, and the for the duration of the 18 minutes. Okay, so this is as exact of your Same exam situation we have created in the Super 60 test series, which have all the important questions and all the recent questions, all the updated questions, and all the questions which is necessary for your selections. We have integrated in the Super 60 test series. Okay, so stay connected, stay motivated, keep practicing. Okay, so if you are practicing the real time situation exam, so it will be easier for you when you will sit in the exams. Okay, so thank you so much for watching the video till the end. We will meet in the tomorrow session again. Tab tak ke liye bye bye, take care, love you, jai hind, jai bharat.